Hey, future medics, Tina here, your medic mentor. And today we're talking about another fluid you're going to see pretty often in EMS, lactated ringers, or LR for short. Lactated ringers is another isotonic crystalloid, just like normal saline, but it's got a little more going on under the hood. So let's talk about it. LR is a balanced fluid that contains sodium, potassium, calcium, chloride, and lactate, all electrolytes that your body uses to function. This one was made to mimic more the natural plasma of your body, which makes it a great idea for fluid resuscitation of a patient who is losing both volume and electrolytes. We use LR in situations like trauma, shock, burns, and significant fluid loss, but in times where we need a little bit more than just salt water. It does still look a lot like normal saline, though, in the protocols. We're still going to give it IV and IO. You're still going to see a bolus of 500 to 1,000. An onset, immediate. Now, here's where Ringers stands out. Ringers contains lactate. Lactate is metabolized in the liver into bicarbonate. Bicarbonate helps buffer acidosis. So this is great to use in patients where their pH may be getting a little too low for comfort, like shock and trauma, but also burns, right? Here's the counter. Because of that same lactate, we don't want to give this to patients in liver failure because their body cannot metabolize and handle that extra lactate. So it's going to be a contraindication for this one. Since Ringers contains calcium, you don't want to use it in medications like sodium bicarbonate. It will cause a precipitant that will clot your line. This also cannot be used in blood transfusions. It causes a precipitant of calcium citrate, which will clog your line. If you're having to give multiple medications with lactated ringers, make sure you know the drug interactions. There aren't many contraindications in the medical world when it comes to lactated ringers. It looks a lot like normal saline. We want to be cautious of heart failure and renal impairment because these patients are going to have a hard time getting rid of that extra fluid. Now, here's your takeaway. Lactated ringers is a great medication. It's especially useful in shock, dehydration, burns, but it's not without its risks. So make sure you know the medication interactions, you know why you're giving it, monitor your patient very closely, and know what's in your bag. That's another one knocked out. You're doing such a great job. You'll be ready for paramedic school in no time. I'll see you for the next one.